Hello, everyone. My name is Daniel Schoonmaker. I'm the Executive Director of West Michigan Sustainable Business Forum and pleased to welcome you to our presentation today. For those that are not familiar with our organization, Sustainable Business Forum is a collaboration of business and institutions dedicated to promoting sustainable business practices with a focus on climate leadership, social justice, and circular economy. This is the fourth in our series of online discussions on how the coronavirus pandemic is impacting sustainability and sustainable business, and the second in our two-part series examining the disproportionate impacts of the pandemic and its containment measures. Videos of today's program and the prior sessions are available on demand at no cost. You'll receive a link to those with a feedback survey for today's program and any additional notes that may come up during the conversation today via an email later this afternoon. This series and all of our programs are primarily funded through membership donations. If you are not yet a member of our organization, I'd encourage you to become one. There has never been a better time to do so, and the need is fairly substantial at the moment. You may also be interested in learning about our various working groups, including our equity and sustainability working group, our Green Stormwater Infrastructure Task Force, and our new Prosperous Economy working group, all of which have meetings scheduled for the next 2 weeks in April. Our webinar series continues next week with some special Earth Day programs, including Will the Recovery from COVID-19 Be Sustainable Business on Tuesday, April 21, featuring Alan Steinman of the Water Resources Institute, Matt Flechter from the Michigan Department of Energy, Great Lakes, and the Environment, and Bali Kumar of Leading Green, Michigan. Then on Thursday, we'll have a discussion on how COVID-19 should elevate climate leadership, featuring Beth Gimmons of the American Society of Adaptation Professionals, Mark LaCroix of Natural Capital Partners, and John Kinch of Michigan Energy Options. And then the following week, we'll be talking about promoting employee wellness sustainability and community sustainability through food systems among COVID-19 and beyond, which will feature Kate Lito of Experian Grand Rapids, Lisa Oliver King of Our Kitchen Table, and Garrett Ziegler of Michigan State University Extension. Now I'd like to introduce my colleague, Carissa Patron, the Equity Program Manager for the Sustainable Business Forum, who will be introducing our program and panels today.
Hi, everyone, and thanks for joining us today for our second webinar series on how COVID is disproportionately impacting our local communities. And I am thrilled to have the pleasure to introduce our panel today, who will speak to ways in which we can collectively address historical and systemic inequities in our community and our economy. I'm Carissa. Like Dan said, I'm the Equity Program Manager for the West Michigan Sustainable Business Forum. And today we will be sharing a little bit about current impacts to health, our food system, education, along with access to resources as well. So I would like to introduce Stephanie Pierce, who's the Director of Community Engagement for the Grand Rapids African American Health Institute, along with Sergio Serra Reyes, who is the Director of Community Engagement for the Urban Core Collective and an organizer for Movimiento Cosecha, and also Dave Bulkowski, who is the Executive Director of Disability Advocates of Kent County. Thank you all for joining us today. And I would like to start off by asking you all to share a little bit about the work that you do and how that work has changed during this pandemic. If you would like to start, Sergio.
Yes, at the Urban Core Collective, I'm responsible for, recently been organizing a group or supporting a group of stakeholders to create an engagement model so that everyone in the city can have the same engagement experience, regardless of who they know or where they live in the city. Have also been, give me one sec. Have also been new to climate change work. The Urban Core Collective is not involved in climate change until recently, and so that's a new venture for us. Also involved with the Latino Community Coalition. That's an organization that's been in existence for about 10 years and have recently started doing a lot of work around advocacy. And then also with Movimiento Cosecha, work that has taken on a lot of the nature of its work has gone into advocacy for the undocumented community during these times.
Thank you. Stephanie, would you like to share a little bit about the work that you do and kind of how that has transformed during this time?
Absolutely. Large part of my responsibility is health and wellness programs and just trying to get the message out to African Americans since we have such a high prevalence of disease across the board. And so our goal is to impact that and try to make a change and to lower those disparities. So a lot of my programming include diabetes programs or health and wellness programs for women. So we're focusing on diet and exercise to see how we can bring down that disease impact. For example, diabetes is really high in African American population, and as you can tell with this new outbreak, that's an underlying issue that's also impacting and helping to cause death if they do get infected with the COVID-19. So definitely has shed some light for me that more education is needed, more programming is needed, and how we can best get this information out and to let people know that actually have these underlying issues, how important it is that they stay diligent and focused on keeping sanitation and keeping their areas clean and social distancing and making sure you're going out with your proper PPE on because this is just a disease that's a virus that's going to impact the disease and hinder your improvement.
Thank you for sharing. And Dave, would you like to speak to a little bit about the work that you do and how this might have transformed your work as well?
Sure, thanks, and thanks for having me. Disability advocates, our mission is twofold. First, we work alongside people with disabilities so they can live self-directed lives. And secondly, we work to create a welcoming and accessible community for all. In that work, we provide an array of supports and services to people with disabilities, and all of that has gone virtual, either the technology of a phone or this new Zoom stuff, or at least it's new to me. And so we've been doing a lot of directing people to community resources, and then also doing wellness checks via the phone and internet on the one-on-one side. Staff are doing everything they can. We work a lot with high school students with disabilities who are entering the workforce. So I know, for example, a staff member yesterday did an IEP or an individual education plan in a school. I mean, everybody gathered with the student virtually, but we're still as present as we can be with individuals. And then second, on the community side, we continue to advocate for that full inclusion. I mean, and as much as we can, again, via Zoom and the internet. Maybe I'll get into more later, about just making sure that folks with disabilities aren't going to be discriminated against more than is normal, so to speak, unfortunately. A lot of stories around different parts of the state and the country concerning rationing of healthcare and that. So we're doing everything we can to stay active and engaged.
Thank you. And if you could, is there any way that you could increase the volume on your mic? It was a little hard to hear.
Oh, I will try to do that.
Thanks. So thank you for the introductions and a little bit about the work that you all are doing in our community. So we have seen across the country, not only in the US, but across the world as well, but in Michigan specifically and in our region, how historically under-resourced communities have been disproportionately impacted by this pandemic. We would like to recognize that even being able to stay at home right now is a privilege for many people. Could you all speak to a little bit about how you have seen how COVID has really impacted the communities in which you work and serve, and what you are doing to help to meet those needs right now currently? Stephanie, would you like to start?
Sure. Well, some things that I'm hearing from community is the fact that people are, for one thing for sure, people are nervous. They don't know a lot about what's happening with this disease, with this pandemic. They don't know about their finances, resources, the access to food, the shortage of things. And when you go to the store, hours are now limited. You don't know if you're going to get the items that you need when you get there. Just trying to order things online has become an issue as well. So a lot of things that I'm hearing from people is that they're just distressed about, what's going to happen when this is over. How will this impact, will I have employment when I come out of this? Am I going to have some place to live when I come out of this? Right now, there are securities in place to keep people from evictions. But what happens when the rent comes due? Because at the end of this pandemic, that money, will I have employment and can I meet those needs? And so it's just so important that we make sure the resources get out to the public, that they know where they can go to seek help. We try to tell people to call different agencies, for assistance. And if you have the money to pay your bills, pay them. If you, try to save as much as you can, try to be diligent about different things. Partnering with different organizations to get this message out is great. And I just hope that, because I have seen a lot of collaboration, and I just hope that continues.
Sergio, could you talk a little bit about the disproportionate impacts that you've seen within the underdocumented community?
Sure, I've seen, I think this is a very much a class structured issue, that the disparities are clear across the board. With the undocumented community, we've seen that we're down to the basic needs, right? Food, shelter, safety, and then support around technology and access. There's also been, both with the UCC and have been started doing mental health workshops for people that are at home, that are stressed with COVID-19, that are stressed with about all the impacts of losing their employment, not being able to meet their needs, worried about loved ones, seeing how trends are impacting specific communities, and dealing with that, juggling having to homeschool their kids in the absence of an established relationship with systems that can help them to do that at home. Those have been the needs that we've seen with the undocumented community, but also the lack of qualifications to receive like the federal checks that are coming to people. Other services that they've never been able to qualify for, like cash assistance or these other types of aids that are now considered public charge, that they desperately need right now, they don't qualify for. And so as I guess I can talk to the advocacy piece on that as we move forward in this conversation.
Thank you for sharing. Dave, what about you? How do you see that COVID-19 has disproportionately impacted the community with disabilities?
Well, first and foremost, to point out, that folks with disabilities are not a monolith. That there's a huge variety of disabilities. And for example, Sergio alluded to it, folks with mental health conditions, that staying at home by yourself could be almost the worst thing that you could do. And so how is that person getting the mental health support that they need? And then you weave into, again, it's things that both Sergio and Stephanie noted, the digital divide, which was extremely real before COVID-19. Now it's not only real, it jeopardizes a person's well-being, that just how can they connect to the outside world. And so I'm sure people have heard it before, but the meme that is making its way around, or has made its way around the disability community, is that social distancing does not mean social isolation. However, that is easier said than done for a lot of people. And then another group of folks with disabilities, people who use personal care attendants, there's all kinds of issues related to that. Can people come into your home or not? How are you kind of trying to be quarantined in a smaller group of people, you know, and it's folks who are, I don't want to say they violate the rules by allowing a person's children to come with them to work. And it just, again, it's just a lot tougher for some folks to get their basic needs met when staying separate is not either the best for your mental health or for your physical health. So those are some tough things.
Yeah, Carissa, can I add something else?
Yeah, for sure.
That I know that I'm receiving calls on as well is the loss of health insurance. So a lot of people are worried about if I lose my job now, and some people have been terminated from employment because they just can't afford to pay them. And so they've lost their health insurance. And some of these people have underlying conditions as well. And so they can't afford to pay for their medications. And so now they're worried that they won't be able to receive maybe the expanded Medicaid or something. If they have a pre-existing condition, can they afford coverage even that goes through the marketplace to purchase insurance? So that's another big issue that we need to address.
And we have a few questions from our audience members specifically for Dave on this issue. Could you expand a little bit about the rationing of healthcare that you had talked about?
Sure. I mean, the good news is we have not heard of any instances here locally. To say for us thus far, I think due to getting into social distancing and closing down business as usual earlier before the pandemic really hit us has helped. So, you know, our hospitals are not being overrun as they are in other parts of the country. That being said, you know, we have heard from our sister organizations in Southeast Michigan, and then have been part of calls on a national level that, you know, unfortunately, healthcare workers are making decisions. You know, if you have, just to make numbers up, if you have 10 ventilators and you have 15 people who need those ventilators, do you decide, okay, this person's sitting in a wheelchair, his quality of life must be bad because he's in a wheelchair. And again, I'm putting my values on that person's life. And so this person's one of the 5 who's not getting a ventilator just because he's not in a because he's in a wheelchair. This person has Down syndrome, you know, that we're putting our labels on people. And again, I can imagine that also is impacting the immigrant community and is impacting other folks of color, that people are judged not worthy of healthcare. And this is not a theoretical situation in many of the hotspots, that these things are happening, where, again, people with disabilities are judged not worthy to receive the care. And hospitals need to have these crisis plans in place. And the issue is making sure that they're not discriminatory on their face. Again, if there are 15 people who need a ventilator and you only have 10, you will have to make decisions. But are those decisions being made on, you know, we go to the highest bidder and we start from there? Who's got private insurance? They're in for sure. You know, so we did send a letter. It was co-signed by 9 other disability organizations to our 3 local hospitals and the Kent County Health Department to, again, I mean, we first thank them for their hard work in this time and their dedication, and to make sure they're following the federal guidance on non-discriminatory care and offering our support if and when they either review their plans or if they have situations that they're dealing with. Again, locally, we haven't had those situations, and hoping that we don't.
And definitely the judgment within our healthcare system is not new to COVID-19. It's definitely been systemic and historic as well. So these are things that we definitely need to focus on moving forward, and making sure that these impacts are not so disproportionately focused on specific communities. So we've talked a little bit about the underlying historical and systemic inequities within our communities, and moving forward, what are some of the most pressing needs that this pandemic has really elevated for the communities in which you work and serve, and how do you see that systemic and structural change helping to be the catalyst for a future movement?
You know, Carissa, you say that, and this is such, I'm sorry, were you speaking with me or with Dave?
Anyone can
Okay.
speak to that.
It's just, this has shed a light on the systemic inequities that have taken place over a long period. And if this does not show everyone that there's a time for change and that action is needed now, I don't know what will. If you look at this, African Americans we make up a portion of the population that's dying. 40% in Michigan are passing away from this, and because there are underlying conditions. But these, like you said before, these conditions are not new. These have been in place for a long time. And so it is definitely shedding the forefront. I was happy to hear the governor has noticed that and taken light of that. And I hope that she really does move forward with some new processes and procedures to try to make some changes in this area with healthcare. Like Dave said, that access to healthcare, there's so much just mistrust in the African American community. They don't want to go to the doctor because they don't want to be used as a guinea pig. They don't want to go in and have treatment different from their counterpart. They want to go in and have the same treatment, the same access to healthcare, the same access to a doctor, any medication. And with that distrust, a lot of the underlying issues have come about because they don't trust them, so they don't go in to the last minute. And so when we get there, we're at stage 3 or 4 because we haven't had the preventative care in the beginning. So this just shows you that preventative care needs to be addressed. We need to address some of the underlying issues that have been in place for a long time, the systemic things like racism, lack of access, all those things need to be addressed. And it needs to happen now, because if this doesn't show you that, why do African Americans have such a high prevalence of diabetes? Why do they have so many secondary conditions? This is not all this doesn't happen overnight. This is a long history of social determinants that have come to hit us in the face, and it is now time for us to stand up and do something about it.
I agree. Go ahead.
Just adding to what Stephanie was talking about, that this actually highlighted the systemic inequities that already existed, brought them to light, and presented it in a way that it's impossible to ignore and to brush off. Things like, and these are not specific to the undocumented community, these are linked to, I would say, more class. So people in poverty experience these, but I think something specific to the undocumented community is the fact that they've been relying on random services that are available to them that do not require legal status. And this has highlighted that there's a lot of individuals, a lot of children that were born here in the US, a lot of American citizen children in mixed status families that do not qualify for services. And it's bringing to light the requirements of different services that are now a barrier. So then also the capacity of systems of the county, of the city, to communicate with other communities in their own language, not just Spanish. There's multiple languages that are spoken in Kent County. And then recently, Latinx GR, a group of organizations that are from the Latino community, the Hispanic Center, the Hispanic Chamber, Latino Network, Latina Network, the Latino Community Coalition, had to come together to request that systems, the county specifically, produce information in a timely manner in Spanish and other languages. So those are some ways in which systems have not been prepared. And I think that what I'm afraid of is that, well, the problem has been that these systems have relied on the relatively small visibility of these systems and relied on philanthropic approach or nonprofits to meet these needs that should have been there, they should have the capacity to meet. And now this is coming to light, shows that that model is not sustainable and that needs to change. In order for that to change, I think that communities and the organizations and people that are working in the fields that we're working in need to hold them accountable. And we need to have a dual approach. One where the need is met, yes. Some of us need to be focusing on basic needs, but there's others of us that need to be focusing on changing systems. It needs to be, we need to take that as our responsibility to ensure that this doesn't happen again. Because if we allow community to meet the needs itself, then we are just enabling the systems to continue as they are and not change.
Yeah, and I would simply add to that, looking at the unfortunate hotspots of inequity, as Stephanie noted, the infection rates and death rates within the African American community. And okay, how do we really look at causation so we can change things further upstream? Within the disability community, the hotspots that are nursing homes. You know, if you're in a nursing home, you are a person with a disability, I should say, as a resident. And how, first and foremost, should people, do those folks want to be there? We actually have a program that we help people leave nursing homes and move back into community-based placements. We're doing a transition next Monday. As our staff says, it's extremely unique doing this virtually, but helping somebody move back into the community. That being said, if a person chooses and the nursing home is the right placement, you know, the funding mechanisms there are such that, I mean, all nursing homes in town right now are just scrambling to make do because, for example, most meals are served in a congregate setting in a you know, to say normal times, and now to deliver meals to everybody's rooms and use extra PPE. I mean, all those additional costs are already stressing an overstressed system. And I'm talking about the private pay places that are extremely expensive, let alone the Medicaid beds in town, that again, staffing is just not adequate. And I think there was a statistic on the news a couple days ago that more than half of Michigan's nursing homes report being understaffed because then staff don't want to go in because of the infection rates. So it's just, you know, to really look at what's happening, you know, to use the old adage of following the money and where is it going and where it's not going.
Thank you for all of your thoughts. So there's been a question from one of our attendees about working within the system or versus outside the system. For this person, it seems like systems have been super unprepared at best for this pandemic. And how can efforts be best spent on direct action? Is it working within systems? Is it working outside the system? I was wondering if, Sergio, you could start off by talking a little bit about what other states have been doing within the undocumented community and how maybe that could be a way to address some of these issues, and then the others I would like to invite to respond to that as well.
Yeah, so I've seen specifically a recent article about the Latino Community Foundation in California has joined a group of like 40 other stakeholders that are pushing the governor to push for specific measures, which they extend the qualification, basically asking the governor to allow people that are undocumented to qualify for services that they historically have not been able to, so make an exception for that. And there's also undocu funds that have been created by others, by foundations, and we're talking about millions of dollars that are set aside for communities. And so those are some of the ways that people have approached it. I know locally here, the Grand Rapids Mutual Aid has been a way to do that. And there's actually conversations among some of the Latino organizations to push for funders to create a local fund. And I know they're still discussing that. So those are some of the ways that I've seen. And what this is, I think, is just asking people in community to come to the support of their neighbors, in light of the fact that systems were not prepared, that government entities were not prepared to meet the need. And again, I think that this should not substitute the push for, it should be in addition to holding systems accountable for being prepared and adapting sustainable models of responding to the need, especially in times like this, for all communities, and not to rely on the public to come to supplement the responsibilities of our government.
Stephanie or Dave, do you have any thoughts about that, working within the system versus outside of it?
I would. Oh, go ahead, Stephanie.
No, you go. Okay, sure. So that is working alongside systems level organizations and companies. That is one of the focus of GRI, to try to change some of this inequity that has taken place over years. So the focus is try to get systems to see things from a community standpoint, and actually try to get community and systems levels to meet at some point in the same place, so that we all work for the common goal.
Yeah, and I think adding to that, it's a both and. It's definitely working as well as we can within existing systems, because knowing that, government entities at the federal level weren't prepared for this, and even to ask the question, how well were we prepared in Michigan, that it's making sure we are prepared and within that system. And then at the same time, are we developing additional models? Back to nursing homes and long-term care, we as an organization will continue to advocate for increased wages for direct care workers in the existing system. And at the same time we're doing that, we've actually been working for a few months on the development of a community cooperative for personal care attendants to have a stake in the ownership of the entity that that provides that care for folks. In addition, that people with disabilities would be part of that ownership model. So it is a both and. It's how best within the system, and then creating additional models that, when they're successful, the system will adopt them.
Carissa, can I add something about Movimiento Cosecha? Movimiento Cosecha has worked outside of the system because historically politicians or political parties have promised the immigrant community that if elected, they will pass immigration reform. And so then it's happened so often on both sides that Movimiento Cosecha decided to organize outside of the system. And I think as it applies to this example or the current situation that we're in, the qualification for people as funds come from federal, from state, from local cities, there's always the qualification and strings attached that the money is not to be used for the undocumented. Even we see it in the business community right now, folks that are struggling, business owners in Grand Rapids that have for years been boosting the economy in Kent County, creating jobs and giving back to community, are not able to benefit from these loans that are coming in. And so we're talking about creative ways to do that. And so I think that the outside game that we talk about is really necessary, like David mentioned, in order for us to have that agency and the control of who gets the funds that we are able to leverage from community and our networks, and that desire of people to support each other. I think that's one of the benefits that comes in, where there's no strings attached, no red tape, and the funds are able to be used in the way in which community determine. That's one of the benefits of working outside of the system. I like David's idea that if we make it work on this way, then people and funders or other entities that are afraid of being associated with having created a fund for the undocumented community they won't have an excuse not to align with it and not to respond to community need. Because at the end of the day, if what are we saving the social networks, the social capital that we have built as entities, as institutions, as individuals, if not to use for a time like this?
Thank you for sharing. So due to a lot of the historic, systemic, and structural inequities that have been embedded in our community, we've seen that communities in which you work and serve have been very, very resilient and strong over time and now. How have you seen in ways in which the community's now collectivism, this collective response, has helped to focus on those who are the most under risk and at risk and under-resourced at this time? Sergio, would you like to start?
Yeah, I can speak to a couple of examples. So I mentioned earlier about translation and interpretation for communications put out by the state, by the county, and the city. We were seeing that a lot of the communications coming out were not coming out in Spanish and other languages. And so we got together to create a network of people that were available to translate communications. We wrote a letter to the county, asking them to respond better in timely manner, and also asking them to establish permanent or to build capacity that was permanent even after the pandemic. So that was something that resulted a group of people that were I think it was like over 30 people that volunteered to serve as translators and interpreters of communications that were coming out. And so that list is available to share. And then also the Grand Rapids Mutual Aid is something that was, I think, existed before this, but it's also a great example of how people have come together. They created GoFundMe, and I think they're working on their second one. And I think using that community response to meet people's need individually, and not just with resources, with money, but also with like donations and volunteering of time and services to deliver things to people and to volunteer at different locations. I think it's been like a crowdsourcing of to meet the need. Those are two examples that I can think of right now.
Thank you.
Yeah.
Stephanie?
Yeah, I've also noticed the increase in volunteerism throughout the community. I'm happy to see the different food banks that are opening up, and different organizations that normally didn't have a food bank or anything for people that are now making it accessible to them. I've noticed the Hispanic Center has a food drive. They're hosting one now, I think every Wednesday with Feeding America, maybe out at Woodland Mall. So it's good to see these resources. People are, and a lot of the virtual education that we're finding online now, like UCC did in Grahi with the mental health series. There's a lot of different focus on finances and what people should do with the stimulus checks and what you should do after COVID-19 outbreak is over and you go back, and how to maybe live on a budget, and just a lot of different community advocacy that you did not see before, and people advocating for each other. So I love the way that we're pulling together and trying to make this as best we can for everyone. Just try to make it work for everyone, because this is a very trying time, and there's a lot of fear and uncertainty out there. And just with, like you said earlier, but the mental health focus is great, because that's something that we didn't focus a lot on in African-American population. And I see more people are starting to become aware and actually to get the services, how you can get that virtually, as well as hotlines that are available. So I'm just happy to see that the resource getting to the community.
Thank you. Dave, would you like to speak to that?
Just to add that, I alluded to it earlier, the letter that we sent to the local hospitals and the health department, we had 10 disability organizations sign on pretty quickly. And so it's, that effort to continue to work together and to cross promote sounds too whatever, but definitely it's, for example, with the deaf and hard of hearing community, that it's great to see the sign language interpreters at a lot of the briefings. However, are the hospitals and healthcare providers making sure they have interpreters at those individual doctor's appointments and whatever treatment somebody needs? And so we're continually reminding folks of that need for accessibility. Same with folks with visual impairments. It's working together to keep that in front of people.
There's a question from one of our attendees. What are other ways in which we could stand up in face of this pandemic as a collective whole or individually? For example, there is obviously a lot of rent and debt inequality. Was there an idea about maybe like a collective debt or rent strike? Are there other ideas that you all have of how we can really help to advocate for and best support these communities that are being disproportionately impacted by this pandemic?
I think we definitely have to stay on top of these issues. We definitely need to advocate for people that can't advocate for themselves. We need to empower people so they can stand up and fight for themselves as well. As far as the rent strike, or I'm not sure if that's the best idea, because at the end of the day, they'll still have to pay the rent. But we need to find ways to show them how to get the resources to help them pay the rent. And if that means taking them through a budgeting class, or if that means, and we can find those virtually online now, if that means that we have to try to work with them and maybe the landlord, because the landlord still has a mortgage to pay as well sometimes. So they're thinking of self-preservation as well as the person that's trying to make the ends meet and trying to pay the rent. So there has to be some type of way that we can advocate to get these people on the same page so that they can make sure that this is a better outcome for everyone and that no one's left behind. So definitely trying to make sure that people are aware of what they can do to seek help. There are a lot of resources out there now. And so we need to make sure that everyone's taking advantage of it and the fact that they know it. And as Sergio said, that needs to go in all languages because things are happening and people are missing it because they don't understand what's available to them. So we need to make sure that this is available on all levels for everyone.
I would add that I think that one way that we can come together is to stop and analyze the role of even our organizations, even as individuals. Who are we as institutions? Who are we as organizations? And is that good enough during these times? Is our traditional mission and staying in our lanes and fighting mission creep, is that a time to focus on? Is it a time right now to focus on that? Or are these extraordinary times calling for measures that are needed to meet the need? Because after the fact, when we see that we could have done more, we're not, we're not at the peak. It seems like there's a lot of that's coming our way. And I think that right now, the people in office, people in positions of power, people that are controlling funds coming in, they're looking to the public. A lot of decisions haven't been made yet. And I think that as the public, we need to we need to encourage public servants to think bigger, to think, to allocate more resources that might not be allocated in other times. And because the need is greater than I think the responses that we're getting right now. So as community, as institutions, we need to leverage those relationships, those networks that we built now to collectively push on our elected officials and people making decisions. I think in Grand Rapids and West Michigan, people respond to the public, to the public will. And we need to create that public will and not, we've seen that if we do not come forth to give feedback to our leaders, they might not, think that it's a need. And so I think that's something that they need to hear from all sides, from as individuals, as leaders of organizations, as employees, from different institutions, from the clergy. I think this is something that they need to hear from all of us.
Yeah.
Dave, do you have anything? Go ahead.
Nothing. We can move to the next question.
Okay.
I was just trying to say, I agree with you, Sergio. It is time for people to definitely advocate. And if you have to reach out to your elected officials and let them know this is on your mind, this is the time to do that, because they, we put them in office, so they need to hear, what we're saying. And it's important that they know that people are out here and people are scared, people are hurting. And it's time for some changes in the community. As we can see that it's time to make some changes to some of the policies and procedures that have been in place for decades that don't benefit the community as a whole. So it's definitely time for us to stand up and make that information known. Make sure that we let them know how we feel about the inequities that have taken place, and that this is time for a change, and that we're going to stand up and stand for that change.
So we've talked a little bit about how our systems don't necessarily work for everyone, and steps that we can take as individuals, as organizations, as institutions, and how we can reimagine this new future moving forward, taking with all the inequities that we've discussed today and moving forward to solutions for the future. So as we know, Governor Gretchen Whitmer had last Thursday created a new state task force on really examining these racial disparities within healthcare. And yesterday we saw this great disparity between folks who were protesting her stay-at-home order, and then on the other hand, there are people who are definitely suffering from this pandemic and maybe unable to stay at home or have lost loved ones. So there's this great disparity between our communities as a whole as well. So with these challenges that our governor and other elected officials face, if you were leading the fight in this charge against this pandemic, COVID-19, how would you go about addressing this crisis now moving forward?
I mean, I'll quick jump in there in the sense of I personally support what the governor's doing and saying. It's interesting, again, the memes out there that because we don't have a massive spike in infection in West Michigan, we're like, well, we don't need social distancing. It's like, no, that proves social distancing works. And I totally understand the stress that this is causing to individual families, individual businesses, and I get that. At the same time, to be committed that we're going to work together to get out on the other end. When we really talk about equity and, to piggyback on the answer to the previous question, to disclose, I think many of you know, I am an elected official. I am a county commissioner in my spare time. And people have to tell us, this is what an equitable health department needs to look like on the other side. I mean, personally, I think our health department's doing a great job today, and they're going to be open to additional suggestions and more than suggestions. It's like, we need to stop this. I mean, myself and a couple other commissioners, have been advocating a lot on the lead issue, and we've been asking people to tell us to do more, because we do at times listen to, I don't want to say broadly, we always do, because we all know politicians. And as Sergio said at the very beginning, sometimes politicians say one thing, do another. But all that being said, it's really to focus on that. How are we going to be in this together, as opposed to the forces out there are going to want to divide us? People are already saying, wow, it's the darn immigrant community. They're taking our healthcare, they're taking our education. And it's like, who's out there, tending the fields, the food that's magically appearing at Meijer and Family Fare? No, that doesn't magically appear. There are people out there working to move this stuff along. And how many of those folks are immigrants? And who cares about their status? These are folks working hard. So are we really going to focus on what can we do together as a community to make this happen inside and outside of systems?
Absolutely.
I think, what I have I think the approach that I would take is kind of a bold approach. I think now is not the time to try to keep things as they are. I think that there's I would focus on elevating and sense making for the public, because I think the public is looking to leadership to make them feel safe, to help understand what's happening. And I think that elevating information, accurate information, getting the experts, doctors, and basing all decisions on data, unifying the public around a common goal and keeping them informed constantly. But also, I think focusing on system change theory, where we're dissolving the problem versus maintaining a status quo that brought us to where we are, and making sense of how, connecting the dots to the causes of the inequities, the causes of how we got here, and to leverage the fact, data, history from the 1918 pandemic, and how everything is happening all over again, and helping the public to understand. I think that those would be, that's the approach that I would take, especially on the highlighting the systemic inequities and addressing class. I think that is very important. I think there's so much misinformation, and the public, I think, needs to understand that big changes are needed for this to not happen again.
Mm-hmm. Absolutely.
Is there anything that you would like to add, Stephanie?
I'm with Dave. I agree with what the governor, as far as the lockdown, until we can get a handle on this. It looks like on this side of the state that we're not as impacted as they are on the east side of the state. But if we don't take preventive measures now, as we are doing, that could change. And so I think it's just important that we look at it from both sides. We need to protect our healthcare workers. The more people are sick going in, the lack of PPE, those all have an effect on what happens to their healthcare as well. They have families as well. And so I was really saddened yesterday to see that display. I understand that everyone has concerns. What drives people is different. Everyone has a different motivation. But at the same time, we need to look at this as a big picture. This is not just special for me or special to you or to the governor. This is impacting the world. And so the way that we handle this now and way we now get prepared for something like this to happen in the future, the way we start to work on systemic change within our current systems, and work on trying to maintain a healthcare system that's beneficial to all, and make changes so that everyone has access, we'll get here again. And so how do we prevent this from happening again? So I think now is, like Dave said, the perfect time to come together and to find ways to try to make sure these inequities decrease. This has to stop. And if we can't see now that change is needed more than anything, with the amount of deaths that have happened, not just in the United States, but across the world, there's inequities everywhere. But right now we need to address those issues, and we need to find out, where have we gone wrong in the past? Where have we gone wrong, and where can we correct this? Because people are dying, and it's not just, this pandemic doesn't care what you look like. This is affecting everyone, but it affects people that have had a systemic history of inequities against them. It's really impacting them because they have so many underlying conditions to begin with. So they're already at a disadvantage, and then now they have to try to work with that disadvantage and then take on a new pandemic as well. So this is definitely the time for systems change across the board. And if that means, we have to advocate, well, we have to find positive ways to advocate. We can't, tear a system down. Because I think about how many people were there yesterday, and I didn't see PPE. And so if someone in that crowd was infected, now just imagine how many people now will take on the virus, and then that overflows the hospitals. It just starts this whole circle all over again. And where we're trying to level off the curve, that's going to throw it, out of whack, because now we have all these numerous people. They said what people that are now infected. One person can infect 40. So we need to be diligent about how we prepare to go out into the public, because at some point we have to go out. We have basic needs. So we need to make sure that we're taking care and that we are really serious about this pandemic. And so, yeah, I would definitely, if it was me in charge of it, I would definitely find a way to work on these inequities at the same time, trying to make sure social distancing is happening and how can I best prepare my community for what's happening.
Thank you for sharing. And I think we have time for one more of our attendees' questions, but I know that the economic impacts are very disproportionate as well throughout all of this, but nearly 1 in 4 of Michigan's 4.76 million workers have filed for unemployment within the last month. I think this question would be more geared toward Dave, but if anyone else has any information, I'd welcome you to share that as well. But what does anyone know about what the county is talking about as in regards to allocating financial resources toward those who are the most at risk or vulnerable within this pandemic? And then another follow-up question would be, what are the actions that our panelists, along with all of us, can take to advocate for those and help support folks throughout this pandemic?
Yeah, I mean, to quickly answer, it's unfortunately, each level of government has a different set of tasks, and county government really isn't directly related to the allocation of like the unemployment support. So that's all a state system. And unfortunately, you know, if you're like my children who are unemployed because they work in the hospitality industry and you're trying to get into the state system that keeps crashing, keep your patience and keep going for it and tell other folks, keep patient. The county's role is really the health department, and then making sure that those resources are being equitably distributed around the county, again, before, during, and after this pandemic. So again, I do believe our health department under the leadership of Dr. Adam London is doing a great job, and they continue to keep telling folks, you know, keep apart, keep safe, and doing all those things. And then it is to, you know, advocate, follow the money and advocate. You know, I read something, I think it was yesterday, that in the $2.2 trillion bill, there was a $90 billion gift to the 1% of the 1%. Like, how can this, you know, like, and the loans to small businesses, we at Disability Advocates, being a small business, we applied for one of those, and I don't think we've gotten it because they ran out of money of the $350 billion set aside for small businesses. But how dare they put $90 billion for folks that absolutely don't need it? It was a way to sneak it in, and they snuck it in. And it's like, that is just wrong. And that $90 billion could go to additional unemployment benefits, small business support, you know, you name it. But instead, the millionaires and billionaires just got $90 billion extra in their taxes for this next year, a reduction. It's just wacky what happens, and people are getting away with. So keep following the money, and definitely if it's at the county, city, state level, national level, keep reaching out and telling folks what you see and asking them why it's not better.
Sergio and Stephanie, do you have any quick closing comments about action and steps forward?
I just say, you know, advocate. This is the time to advocate for change. And if we all stand up collectively, we can get the change that we seek. It's horrible that this has taken this many years to come to the forefront, but I think it's out here now. There's no denying it, that there are systemic changes that, or systems that are in place that are a big cause of this in the beginning. And so now that we see this, we know this, we're talking about it, let's do something about it.
I'll say that I think leadership at all levels, at organizations and government and nonprofit, they're ready to hear from the public. They're ready to hear from all of us, ready to hear our ideas. I think they're still making up their minds, still making decisions that are important. I think they respond to the public, to all of us, and that, you know, go to them with our ideas, and also make things happen on our own. Build it, get it done yourself. Join join a movement, join an effort that's happening in the community, because we're the ones that are making it happen. Like, as you can see with mutual aid, get involved if you can. I know that a lot of us are worried about like what's to come, but if we have basic needs met, if we're not worried about how we're going to pay our mortgage or our rent, that means that we're in a position to reach out to others and help. And I think that's what's going to get us through all of this. And we need to take action in that way. And also, don't forget and ensure that this doesn't happen again. If a second round of the virus comes after we contain this first round, are we going to be prepared for it? We need to be asking ourselves all those questions.
Thank you for your time. Thank you so much, Stephanie, Sergio, and Dave, for spending your time with us this morning, and the work that you do in our communities to elevate voices and really focus on advancing equity in our community. I'd like to leave you with one question of how you can really ask yourself and how you can leverage your own privilege and what you've been given to best support others during this time, whether it be through donating your time or money or otherwise. I'd like you to just ponder that question as we move off of this Zoom. But we'll be sending out a recording of this webinar along with a list of COVID resources, along with another list of articles on disproportionate impacts. And we'll also be sending the contact information of our panelists from today and yesterday in case you would like to get involved in the future. Thank you all again, and have a great rest of your day.
Thank you.